Today's topic is the honest truth about manhood enhancement, because there are a lot of folks out there without good credentials and without good morals that will try to sell you something that really doesn't exist. So, I want to start with a disclaimer, which is I'm not advocating for men to have bigger penises. That's between you and your maker, right? What I want is, if you are interested in increasing the size of your penis, and half of men are interested in increasing the size of the penis and the other half are sort of fooling themselves that they don't want that, but there are a percentage of men that actually take action. And the problem is everything that's out there currently either doesn't work or has the potential to cause real problems. And so whether you, at the end of this webinar or not, decide to proceed with a penile enhancement procedure, please understand that the ones that are existing, that are out there, have the real potential to cause damage and are expensive and have a lot of side effects. So just a little bit about myself. I went to Brown University for undergraduate. I did a year of research at American Red Cross with Harold T. Merriman, the person that figured out how to freeze blood for transfusion. Then I went to Vanderbilt for medical school. During medical school, I did a full year of research at Harvard Medical School, sponsored by the Howard Hughes Medical Institute. And that was at the lab where they did the first living-related kidney transplant and won the Nobel Prize for that. And then I went off to UCLA, trained in surgery, and then trained in urology. I'm a board-certified urologist. I've always been sort of a pioneer. I helped pioneer surgical robotics. So we had the first or second Da Vinci surgical robot in the country. I was doing it long before the folks in the academic medical centers. I helped pioneer MRI-guided prostate biopsy. I built kidney stone centers. And about 4 years ago, I got into regenerative urology. So the ability to help men who are no longer able to get an erection to start getting erections in. And I help do research on shockwave therapy for erectile dysfunction, on PRP, on stem cells, on peptides, on high-intensity focused electromagnetic wave, lots of things. And penile enhancement was really like the final frontier, like they say in Star Trek, space. Penile enhancement, safe, effective penile enhancement is sort of the final frontier. And when thinking about what the ideal treatment would be, first of all, it's got to be safe both in the short term and in the long term. It's got to increase both length and girth, right? So if you just increase length, then you end up with what I like to call a pencil penis. And if you just increase girth, then you end up with what I call a pig in a blanket. So you have a thick shaft, but a small head. What you want is natural looking, symmetrical growth with also enhanced function. And you don't want to break the bank with it, right? You want it to be relatively inexpensive. And so we'll look at all of the existing technologies and the P-long using those criteria. And so what we're going to do is look at penile anatomy and metrics. Then we're going to talk about traction devices, fillers, fat transfers, ligament ligation, cosmetic implants. And then we're going to talk about the P-long study, what the technology and the protocol is, and then finally the result. So, let's be honest, size matters to men. It's a symbol of fertility, of strength, of stamina, of social status. And when they do studies, they find that even though 2/3 of men think that they have a normal penis size, about half of those men wish that their penis was bigger. And when they interview people overall, about half of men wish that their penis was bigger, but less than 1% actually wish that their penis was smaller, right? So obviously size matters to men. So let's just talk briefly about penile anatomy. I'm going to start with the top. This is the shaft of the penis, and you can see the yellow are nerves that run along the penis. And the nerve trunks run basically on the top of the penis until they dive down to this area called the frenulum. Okay, and then if you look at a cross section of the penis, these are the erectile bodies, and the erectile bodies have a blood vessel on the inside called the deep cavernosal artery, and they have a tunica or a thick lining tissue on the outside. And when you increase the length and girth of the penis, what you're doing is increasing the size of the tunica, the lining tissue. But this is a really tough tissue because it has to withstand high blood pressures and it has to get banged around a lot, right? So if you have a weak tunica and you fracture your penis during intercourse, you're not going to be able to pass your genes on. So the genes for a tunica that's tough, but that can stretch, were able to be passed on. And then the cavernous artery and all of this vascular tissue on the inside of the penis is what the PRP is causing the growth of. Okay, now the penis at the very base is attached to the underside of the pubic ramus, right? So when you pull on the penis with traction, you're actually pulling against a fixed point at the base of the penis. And then there's what we call a suspensory ligament, which hangs the penis from the underside of the pubic bone. So when people, we'll see in just a second, cut the suspensory ligament, it allows the penis to hang lower, but the penis actually doesn't get long. Okay, so size varies, right? So if you look over here, in general, the African countries tend to have longer penises, and the poor folks from Cambodia are under 4 inches. But at the end of the day, if your penis is adequate for intercourse and adequate for urination, you basically have a normal. So this is a purely an elective procedure for most. And so what have men done throughout the years and the ages? The simplest, most basic technology for increasing penile size is traction. So there's something called jelqing, which is putting traction with your hand, or people use weights, or people use stretching devices. The problem is you got to keep these things on for a long period of time. So, if you look at National Geographic, you'll see that tribe in Africa where the people have really, really long necks and they keep putting those necklaces around the neck. I mean, biological systems are basically pliable because they're alive. And if you put pressure on a biologic system, you can move it over time. The problem with the penis is that you got to have a traction device on for 8 to 10 hours a day for 6 to 12 months in order to gain 1 centimeter or 2 of length. And you're just gaining length. You're not gaining girth. So guys are more focused on length. Women actually care a little bit more about girth because it stretches the vaginal tissue more. And so traction is not a great option because it gives you not a normal looking penis, and women care more about girth than they do about length. Now, just a little bit of an aside, the Darwin Awards recognize individuals who have contributed to human evolution by selecting themselves out of the gene pool by dying via their own actions. And like I said, some of these technologies for penile enhancement are actually dangerous. And this is a study from 2017, or a newspaper article on a man who died getting fat transfers for increasing the size of the penis, right? So how'd you like this news article to show up in your local newspaper the day after you died getting a penis enhancement procedure? Or how'd you like your friends and classmates to go back to their high school reunion, 20-year high school reunion? Oh, did you hear what happened to Joe? No, what happened to Joe? Oh my God, you won't believe it. He died getting his penis increased in size by a fat. So, I don't think you want to be that guy that ends up in the newspaper for that reason. And so really, we have to find something that's safe and effective. So autologous fat grafting is what that poor patient had. So what the procedure is you liposuction fat, you spin it down to take out the oil and the water, and then you re-inject the fat into the penis under the skin and above the erectile bodies. The problem is 20 to 80% of that fat will be gone in the first year. And second of all, this only works girth. And third of all, when I saw this picture, I thought it looked like Kenny from South Park. So you don't want to have Kenny hanging out inside your penis. Now, instead of fat, you can use fillers, right? So the fillers that the movie stars use to plump up their lips or plump up their face, you can use to plump up the penis. And you inject it below the skin and above the erectile bodies. The problem is that fillers are expensive. So depending on how many fillers you use, it can be anywhere from $5,000 to $15,000. And second of all, fillers don't last forever, right? So these movie stars keep having to get their lips and face plumped up every couple of years. And the same thing with the penis, but with the penis, you get kind of a lumpy, bumpy penis as the the fillers get reabsorbed and the fluid in the fillers gets reabsorbed, right? So you have to suspend hyaluronic acid or polylactic acid or PMMA in fluid, otherwise it won't inject through a syringe. And as that fluid goes away, the fillers become hard, firm. It feels like little nodules under the skin of the penis. This suspensory ligament release, it was popularized in the 90s by a surgeon out of Beverly Hills. And if someone from Beverly Hills calls you about penile enlargement or elongation, hang up the phone, right? This was really bad. When I was at UCLA, there was a double-boarded plastic surgeon and urologist there that would end up fixing a lot of these disasters, right? So if you cut the suspensory ligament, then the penis hangs lower by about 1 to 3 centimeters. But when you have an erection, the penis will point to your toes and it's not going to be any longer. So really, this is only for increasing flaccid penile length. But the problem is, anytime you do surgery, you're going to develop some scar tissue. If you get scar tissue in your suspensory ligament, then the suspensory ligament doesn't stretch anymore. And then you actually lose penile length. So these guys were getting an increased flaccid penile length for 6 months. But after that, they would lose penile length, function, and the angle of the erection. And then finally, this is another one straight out of Beverly Hills. It's called the Penile implant. And this is Dr. Elist who invented it. But you can see this is a massive piece of silicone. Basically, it's like a silicone taco shell or hot dog bun that goes below the skin and above the erectile bodies. And what it will do is it'll definitely increase girth, but it does not affect erectile length, right? And it's expensive, $15,000 to $25,000. You're going to have to take a couple of weeks off of work. But if you look at where the implant lays relative to the head of the penis, is a very thin layer of skin over these implants. And there have been some real problems with these implants in terms of infection, in terms of pain, and in terms of the actual implant extruding through the skin. And once these are removed, it's a real disaster. So I've had 3 patients in my office who have had them removed that came to me because they were having a lot of problems and scar tissue and shortened penis and complications from them. And there was a recent paper at the International Society of Sexual Medicine by Dr. Joel Gelman out of UC Irvine, where they showed that a dozen men, they had taken care of a dozen men who had had these removed. And I just think that it's not going to end well for a lot of men who have these. So because I don't mean to be grim, right? There's a happy ending to this whole story. And the happy ending is the PLONG study. So I found 30 men that I recruited to participate in the PLONG study. It was a 6-month study, single site. I was the only injector for the study. I got institutional review board approval. It was listed by the National Institutes of Health. When I got the final results, I presented them as an oral presentation at the International Society of Sexual Medicine in Miami in October of 2022. And what the protocol is PRP, so platelet-rich plasma. So platelets contain growth factors that stimulate the growth of tissue. A traction device developed by the Mayo Clinic, a suction device using a hand pump with a gauge, and the Affirm nitric oxide boosting supplement to boost circulation and erectile. Okay, so the first thing to do is to generate what's called platelet-rich plasma. So we collect blood, and it's important that we collect 60 cc's of blood because in my study, we used over 1 billion platelets per injection. And then you spin the blood. When you spin the blood, the red blood cells go to the bottom, the plasma goes to the top, and in the middle, you have PRP or platelets and white blood cells. And then you inject those platelets both on the right and on the left side. And so this is a cross section of the penis. These are the erectile bodies or the corpora cavernosum. And just take a mental image of that because you're going to see it in an ultrasound very shortly. And the deep cavernosal artery, I want you to take a mental image of that too. And we only inject on the right and the left, right? There's no reason to inject twice in the same erectile body because it's contiguous. And then the traditional P-shot injects in the head of the penis, but I don't inject in the head of the penis because there's no erectile tissue, because the head of the penis is connected to the urethra, the corpus spongiosum, and there's very little nerve tissue up, right? If you want to inject for sensation, inject down here at the frenulum. So really, it's only 2 injections with a 30 gauge needle. If it's done properly, it definitely should not. So let's take a look at the ultrasound-guided injection of platelet-rich plasma, which is a technique that I developed and I teach to all the P-long providers. Okay, so you can see, remember the tunica? And you can see the blood vessels right there. Now, as I rotate into the sagittal plane, you can see, look right there. See the blood vessel? Nice blood vessel. Right now, I'm going to rotate back to the transverse plane. You can see the blood vessels there, and then there goes the needle, right? The needle is right in the middle of the erectile body, and then we inject, right? So this is something that your P-long provider should be able to show you. They should be able to show you the needle actually going into the erectile body. You should be able to watch as that rich PRP goes into each erectile body, both on the right and the left. My patients actually enjoy watching, right? They don't want to look at the needle, but they'll look at the needle on a video screen. Now, once we have the growth factor in there that's accelerating the growth of the penis, we want to increase penile size both in length and in girth. And the reason for that is if you look at the collagen, and the collagen is what makes up most of the tunica of the penis, it runs in 2 different directions, right? It runs lengthwise and it runs circumferentially, right? So you want to be able to pull length, but then also increase the girth. And so the Restorex device is what increases length, and the suction device from Dr. Joel Kaplan is what increases girth. And this is the growth pack, right? So as you increase in girth, you want to have a larger and larger or wider and wider cylinder. And then finally, you want to take a nitric oxide boost, right? And Affirm is the only nitric oxide boosting supplement that has both the citrulline arginine pathway and the nitrate, nitrite, nitric oxide path. In your body, you get half of your nitric oxide from the citrulline arginine pathway and half from the nitrate, nitrite, nitric oxide pathway. This is basically beets and watermelon, which are kind of Mother Nature's Viagra. And what it does is it improves circulation. So you get better delivery of oxygen and nutrients to the penis. And also, when you're asleep at night, you get better erection. And so when you're young and healthy, you should be getting 30 to 60 minutes of erections every night. And what that does is it increases and maintains the size of the penis. So to put all of this together, the P-long protocol is a double spin 60 cc blood draw and ultrasound guided injection of PRP once a month for 6 months. And that PRP contains the growth factors to accelerate the growth of the penis. So the last webinar, somebody asked, well, do you really need the PRP? You know, I guess you probably don't need the PRP, but it's probably going to take 5 to 6 times as long to achieve the same results if you don't use it. It's Affirm nitric oxide booster, 2 tablets twice a day. There are really no downside or side effects of taking Affirm. It really only benefits you. It's a dietary-based supplement with watermelon and beets, basically. The Restorex traction device, 20 minutes in the morning and 20 minutes in the evening, and the use of a vacuum erection device penis pump for circumferential improvement. And that protocol is use it for 1 minute, release for 15 seconds, 1 minute on, 15 seconds off, 5 minutes on, 15 seconds off, 5 minutes on, right? And what this does is, like, when I wake up in the morning, first thing I do is I touch my knees. That's about as far down as I can get. Then I stand up straight. Then I touch my shins. Then I stand up straight. Then I touch my ankles. Then I stand up straight. And then finally I'm able to. That's the way that collagen and elastin interact, is you can't just go and pull straight. You have to stretch, release, stretch, release. So finally, the results. So the amazing thing is, over a period of 6 months, we increased penile length almost an inch and increased the girth of the penis a half an inch. And the other thing to look at is take a look at the growth curves, right? What do you think is going to happen after 6 months if you continue? If you continue to get injections of PRP, to use the traction device, to use the suction device, and to use a firm, that growth is going to continue. And that's what I've seen in my patients who have continued after participating in the PLONG study, is that they've gotten better function, growth, and length. And the reason they get better function is because PRP stimulates the growth of new blood vessels, and new blood vessels increase blood pressure in the penis, which improves erectile function. So just to talk about what we've learned so far in terms of conclusions, most men have adequate penile length for the two functions of the penis, which are intercourse and urination. So increasing the length and girth of the penis for most guys is just elective, right? So 300,000 women each year in the United States get breast implants, right? It's not for any functional reason, it's for aesthetic reasons. So this is purely an aesthetic procedure, right? And the reason that we developed it is because there's a low level of satisfaction with traction devices that you have to use 8 to 10 hours a day, suspensory ligament ligations, which are a total disaster, fat grafting, which can be really dangerous and gives you kind of a squishy, weird-shaped penis. Hyaluronic acid works to increase girth, but it goes away after a year or two, and it's expensive. And pneuma implants are expensive and give you a risk of infection, pain, removal, extrusion. I think the long-term, that's going to be a big... And they don't improve length with an erection, which is what really guys want in the end. But if you go back to that first slide, which is what would the ideal penile enhancement procedure do for you? First of all, it's got to be safe, right? And as the person that injected every single person in the PLONG study and received any phone call afterwards, if they had a problem, PLONG is totally safe. I didn't, knock on wood, experience any adverse events from any PLONG patient. Second of all, it's effective, right? So you get almost an inch in length and almost a half an inch in girth. And that depended on how aggressively you were consistently doing the stretching. But also it depends on what you started with, right? So we're also analyzing the final data as a percentage basis. So if you got a 15% improvement on average, if you started with an 8-inch penis, you're going to get more growth than if you start with a 4-inch penis. And that data, we're working on the final paper now. Hopefully that'll be out in a couple of months, and we'll be able to kind of analyze that data with you in another webinar. The other thing is, this is going to give you a symmetrical, natural looking penis. You're not going to end up with a pencil penis. You're not going to end up with a pig in a blanket penis. You're going to get better function, right? Because we know injection of PRP into the penis improves penile blood pressure, which increases erectile function. And then this is less than half the cost of some of the other technologies that don't work nearly as well. The only downside of PLONG is that it takes work on your part, right? And the more you put into it, the more you get out. So if you are interested in PLONG and learning more about it, first of all, go to the p-long.com website where there's a lot more information, right? So I made a bunch of claims on this webinar about some of the other technologies, but we actually have the source documents, the actual papers that have been written about the complications and downfalls of some of these other technologies. And I also have the data from the PLONG study that I presented at the International Society of Sexual Medicine. And if you're interested in following through with the PLONG provider, on the website, there's a place to put your zip code, and we can match you with a PLONG provider. We're up to 50 providers after, I think, a month and a half. We have providers now in New Zealand, in Bahrain. We have several in Canada, and all throughout the United States. And we're growing really, really rapidly. So if there's not a PLONG provider close to you, there should be. So I hope this was enlightening and educational, and I am more than happy to take any questions from anyone.
We have a question. So the question is the draw and OPRP, or is the draw and PRP injection done at the same visit?
Yes. So typically what you do is you draw blood, you spin the blood right away. It's a double splint system. And within 10 minutes, you should have the PRP, fresh PRP for injection. So, 10, 15 minutes after the blood's drawn, the blood should be going right back into.
Terrific. Next question. How about jelqing as part of the regimen?
That's a great question, but I think the RestoreX traction device is going to be much more effective than jelqing. And also, jelqing doesn't improve girth or circumference of the penis. And so, you're missing out when you're jelqing on that. And so the vacuum erection device is going to be a really part of it. But, once you put on a penile traction device, like a good, legitimate penile traction device, and if you look at the papers written out of the Mayo Clinic on the RestoreX device, they actually compare it to another device called the Andropeyronie device. And this is in patients who are undergoing Xiaflex injections for Peyronie's disease. But the results on Xiaflex are much, much better than the Andropeyronie. So this actually is a legitimate medical device that has been well tested by one of the top urologists in the country, out of one of the top institutions in the country, the Mayo Clinic.
Perfect. And then we have another question. Well, it's a two-part. So part one is, what's the average cost for P-Long? And then the follow-up question is, are there any pictures available? Results.
Yeah. So in terms of the average cost, we're recommending between $5,000 and $6,000. The actual equipment is available through our website at a discount, and it costs $997. And then that gives you a $500 off coupon that you can bring to your provider, right? So providers are basically responsible for their relationship with you. And obviously the cost for a provider in downtown Manhattan is going to be different than a provider in Nebraska. So you'll really have to work out that with the P-Long provider, but we do have recommendations to our P-Long providers, and we want them to be able to do it at a cost that's fairly reasonable. And then the second part of the question was,
if we have any visible results.
Yeah, a lot of folks are not really super excited about sharing pictures of their penis. And, honestly, we all know what penises look like and what bigger penises look like. And these are natural, symmetrical, normal looking penises. They just look
terrific. Does the head get bigger?
That's a really good question, because we're not really injecting the head of the penis, but for whatever reason, I think it's mostly because of the suction and also because of the affirm. The head seems to grow proportionally with the rest of the penis.
Terrific.
But we didn't take specific, the head of the penis is really difficult to measure. We didn't take specific measurements.
There's no penis head measurement devices available on Amazon?
Everything's available on Amazon.
My birthday's coming up.
Yeah, there you go.
Okay, we have another question. Okay, so after the first consultation and draw, my understanding is that we have to come once a month for other injections, correct?
Correct.
Yeah, so it's one injection per month for 6 months. Correct.
And those injections should not be on. And the reason that we provide so much data and so much information is, one, there's so much sham medicine and so much shenanigans that goes on in this space. And what we wanted to do is really bring information, honesty, truth, legitimacy to this space, and to give you some idea of what your expectation should be, right? So I'm not telling you you're going to go 3 inches in 6 months. That's, I don't think, possible, right? I'm telling you, if you want to put the effort in, it's going to be about 1 inch. And if that works for you, great. And if that doesn't work for you, then don't do it. But I think it's important to have the understanding of what to expect. Now, could you ever get 3 inches? Well, if you did this ongoing for 2 or 3 years, yeah, maybe. We haven't done that study. I can only speak to the information and the data that we've gathered.
Terrific. We have another question regarding pricing. So does the price you stated cover the entire 6 months?
Yes.
And then a follow-up question. Okay, after 6 months, do you lose the length and girth if you don't continue injections?
Yeah, so that's a great question, and that's a frequent question that I get. So the P-Long is meant for men between the ages of 20 and 50 who have normal erectile. And if you have normal erectile function, then every night when you go to sleep, you should be getting 30 to 60 minutes of erections. And when you do that, you stretch the penis out to full length. Now, if you have erectile dysfunction, you don't even have enough blood flow to fill a penis up that's normal size or, your existing size. And so if you do the P-long and you have erectile dysfunction, no, it's not going to last. But if you do the P-long and you have good erectile function, then certainly it's going to last. And it's going to last really until you begin to lose your nighttime erections, in which case any guy loses some penile.
Do you use numbing agents for the injection?
You can. So you can use what's called a BLT cream, which is benzocaine, lidocaine, and tetracaine. But to be honest, with a 30-gauge needle and my injection technique, we don't use it.
Can this procedure cause or cure venous leak?
So venous leak is interesting. Some people have a congenital issue with the way that the veins leave the penis. But in order to get an erection, you have to get a blood pressure high enough to block the veins. That's how you trap the blood in the penis. And so using PRP to help grow new blood vessels will actually help improve penile blood pressure, arterial blood pressure, which can help prevent venous leak, but that's not really the intent or the purpose of the P-long. So the answer basically is maybe.
Got it. Are there any side effects for taking Affirm daily for years? Does the effect of Affirm tailor off over time?
Yeah, so that's a great question. There's no negative effects of taking Affirm over time. You don't become tolerized. Our body is filled with nitric oxide. And if you look at nitric oxide levels over time, by the time you turn 50, even if you're healthy, you've lost about 50% of your endogenous nitric oxide production. That's the nitric oxide that you produce on your own. And so you become more and more reliant on diet. So my patients who are under 50, I usually put on 1 tablet of Affirm twice a day. My patients who are over 50, like myself, I take 2 tablets of Affirm twice a day. And just to prove that there's no negative side effects of taking a lot of Affirm, on one of my videos, I took, I think, 8 or 10 Affirm tablets just to see what would happen. And yeah, I didn't have any negative or adverse reactions except really good erection.
Great. We have some more questions coming in. Are you still measuring the initial patients from the study to see if the effects are long lasting? Is anyone still doing the injections past the 6-month mark in your clinic? And what are you seeing?
Yeah, so I have several patients who are continuing to come in for injections, and they're continuing to get growth. And we have, it's really, really hard to do clinical research, and it's hard to get patients to respond to your emails and your texts, and to ask a guy to do measurements of an erect penis at home and take images and send it to us is asking a lot. So we have a couple of patients that periodically will send us measurements, but we haven't been able to engage the patients like we were before when they were coming in for the P.
Great. What is the difference between Gainswave and P-long?
Yeah, so Gainswave is for low intensity shockwave therapy, and P-long is a protocol using PRP traction suction. So Gainswave, the purpose is to improve erectile function in men with erectile. The purpose of P-long is to increase penile length and girth in otherwise healthy younger men, and also carries the benefit of improving erectile.
Great. We have a unrelated question regarding Botox injections, but I would advise you to just email Dr. Brandeis directly. I'll drop the email address in the chat.
Or you can go to my website, which is BrandeisMD.com, go to the media tab, drop down to ebooks, and I have an ebook on Botox for erectile.
Great, I'll actually drop that link in the tab. Okay, couple more questions. So Dr. Brandeis, have you undertaken the P-long protocol yourself?
I have not. I think my wife would get pissed off at me.
Okay. Is it possible to hear from someone who has undertaken the protocol? Will you be releasing images before and after?
Yeah, I won't be releasing images. I think there's so many people that put images kind of before and after images. You can magnify images and make them look bigger. You can demagnify images and making them smaller. So just take my word for it. It looks like a normal penis, but it just looks bigger. And what was the other part of that question?
It was well, two-parter. So have you tried or have you done the protocol on yourself, or are you releasing?
Yeah, so I actually just had one of my patients serve as give his testimonial to a major magazine writer who's writing an article on penile enhancement. And so, there are going to be some testimonials from my patients that are going to be most patients that are folks that do these kind of things fairly
perfect. Okay.
That way they let me be the face of small people.
All right. Is there a map of providers available? Yes. I'm going to drop the link right now. Or actually already did. It's the provider map. Another question. Are there any providers in Australia?
We have a provider in New Zealand, and I did contact someone in Australia. So hopefully I'll get a response. Otherwise, they couldn't do that Thunder from Down Under, right?
How big can the penis grow biologically?
Oh boy, that's a good question. As a urologist, I've seen lots and lots of penises. It's just one of those things. What can I tell you? The largest I've ever seen was about 12 or 13 inches. And I had to put a catheter in that guy. He was like a 75-year-old guy in an intensive care unit. So it was so hard. I felt so bad. It was so hard to put the catheter in.
Like you need an extension cord.
I guess that's exactly extension cord. So I think that's the biggest I've ever seen. So I would say that's probably the limit biologically. But you could test it.
We have another question rolling in. Was there any discrepancy between the young patients and the older ones in the study?
Yeah, they were all young, right? So this is for men less than 50 years old with normal erectile function. So, I mean, I would imagine the younger you are, the better off you would be. But I think the differences are going to be relatively slight. And I certainly wouldn't recommend this for guys under 20. You want to let biology and Mother Nature take its course. And after the age of 20, if you decide that that's just something that you're interested in, then I would.
How do you measure the new blood cells growing?
How do you measure it? Well, the PRP and shockwave therapy is the science is based on doing this in rats, so that rats are animals that you can actually sacrifice and take their penises off. And so in experiments in rats done at UCSF by Dr. Tom Liu, we've been able to look for an upregulation of vascular endothelial growth factor, an upregulation of stem cells, an upregulation of new blood vessels, and an upregulation of nerve growth. And so we didn't cut anyone's penis off during the P-long study. We obviously would never pass an IRB doing that. So a lot of the original research on regenerative technologies in penises were done. So if you're in San Francisco and you see a bunch of dickless rats, you can thank them for getting this study.
How long can you be on the P-long method, P-long protocol?
I would say the sky's the limit. I don't see, it's not unhealthy. It's not really a problem. And so I don't see any reason why you couldn't continue this as long as you want.
Did you see any discoloration on the penis from the pumping or stretching?
Yeah, some guys get some discoloration, not from the stretching, but from the pumping. So you get a little bit of venous stasis and it gets a little bit darker. Over time that lightens up. But while we're doing the injections, you will notice a little bit. And there are some guys that are a little bit overzealous on the pumping, and you'll get little, what we call petechiae, tiny little blood clots.
Were there any effects on the rest of the body from the PRP injections, like muscular growth from the growth hormone?
No. These are all platelets that are in your body already. And so they're just being basically activated and injected into the penis. So there are no effects outside of the penis.
Does the PRP leave the penis after it's injected?
So basically, double spinning PRP, taking it out of your body and then injecting it back into the penis through a 30-gauge needle is traumatic enough that it begins to activate the platelets. When platelets are activated, they basically stick to tissue. And also after the injections, we hold pressure at the base of the penis for about 5 minutes to prevent the blood from circulating around. So the presumption is that the platelets are stuck in the penis, although it's theoretically it's possible for them to circulate throughout the body. Wow, this is a smart group. They asked a lot of really good questions. So thank you very much for your questions, and thank you for hanging with us, and hope you have a great rest of the night.